Hi viewers, welcome back to our channel. Once again, I'm very happy to meet you all in this channel where we are going to deal with community medicine in an easy way. Initially, we dealt with chapter 1 community medicine. Today, we are going to see chapter on health communication. This is a very important chapter with respect to undergraduates, especially third year students who are going for university examinations, because you will be getting uh, even an essay question or definitely a short answer, 5 mark question, and or a 2 mark question from this chapter. So, if you spend few minutes to listen to this chapter in this video and then you go back and read in your book, it will be of great use to you. So, let us quickly go into the chapter. This chapter basically deals with communication for health education, and we all know learning happens in three domains. So, what are the types of learning? Cognitive, affective, and psychomotor. Cognitive domain deals with adding new knowledge to the existing knowledge. Affective domain deals with behavior. It implies that by affective domain a person is able to inculcate a new behavior, he is able to do a new behavior, that is affective part. And psychomotor domain is like a person is able to do a new skill. For example, suturing is a new technique, giving injection is a new technique. If he is able to do this technique, then he has learnt a psychomotor domain during his learning. Now, what are the channels of communication? This is the pathway in which normally a communication happens. There should be a sender, that is a source person. Like for example, I am the sender here. I am giving you some knowledge. That is, I am the sender. And there should be a receiver, and you are the receiver. The audience who are listening to this video, you are the receiver for this content, for this communication. Third thing is the message, the what I'm going to deliver. As I already told you, I'm going to deal with health communication today. So that is the content today. And what is the channel, medium in which I'm communicating this to you? The channel in which I'm communicating is through internet and YouTube. The same thing if I do it in a class, to a class of audience, then it becomes a uh, lecture, whereas here I am using internet as a tool for communication. And feedback is a thing which will always improvise our communication channel. Like for example, if I am not good in this video, then immediately you can comment below so that I can improvise my communication channel. I can improvise my communication better. Similarly, in a lecture for a large group of audience, we can get a feedback later on. But the best place where you will get a feedback is when there is one-to-one communication. When you directly interact with a person, then definitely you will get a feedback, immediate feedback. Whereas in a setting like this, where we are interacting, where we are not interacting face to face, the feedback will be little bit delayed. What are the types of communication? These are the basic types of communication. The didactic type of communication is where I am talking, you listen to what I am talking, and that is dictatorship. What is the Socratic method of communication? It's a two-way method. It is said that Socrates, during his lectures, he used to walk around and he used to elicit the response from the audience. He used to stimulate the audience to ask question, so that there is a healthy discussion taking place, so that the what the Socrates wants to say gets conveyed to the audience better. So in due course of time, this became a type of communication, very famous type of communication called as Socratic communication. Then there is verbal communication, where we are speaking and communicating the information to the audience. And there are non-verbal communications like the non-verbal cues. Silence is a form of communication. Our body language, how we react with face, how we are doing our body language, it is also a type of communication. Then visual communication through the use of audio visual aids, like TV, newspaper, and internet. If you give the information, it becomes a visual communication, telecommunication, and internet. Then, what are the barriers for communication? It's a very famous two-mark question in our university. There are four basic types of barrier. Physical barrier, when there is visual disturbance, I cannot see. When there is hearing disturbance, when I cannot hear, it becomes a physiological barrier. Physical barrier. What is a psychological barrier? When the person is not attentive, he is not having interest in what you are talking, he is having attention deficit disorder, or any other neurological problem, it becomes a psychological barrier for communication. What are the environmental barrier? If you are listening to a lecture in a silent environment, there is no problem. But when the environment is noisy, crowded in an outdoor place, then there is an environmental barrier. Similarly, there could be some many types of environmental barrier and cultural barrier. If whatever you are talking, if only if it is culturally acceptable, it will reach the audience. When the content of your speech is not culturally acceptable, definitely the audience will not accept your communication. So these are what are the types of health communication? Means from how we can give a health communication. These are the basic things in giving the health communication which you are giving to the patient. This information, whether it will be converted into action, definitely it will not be converted into action. Information is just facts. You are giving the facts like you are suffering from this disease. You have to take this medicine. You have to take this medicine for 7 days. It doesn't give any motivation or any sort of action or any sort of behavior change. Whereas information is different from education type of. When there is education, is what's meant by education. Education is facilitating the learning. You are giving the option and you are asking the audience to choose which option happen with education. So you are giving different options are there with respect to family planning. Then you are asking the audience to choose which tip is better for education. But still, the education alone is not enough to bring about a behavior change. Then what is most important is motivation. The motivating the audience, the content which you are giving to the audience, you should create, the audience should first of all accept what you are telling. They should take it inside their mind, they should internalize it, and they should accept what you are telling. Yes, it is true. If I change this behavior, it is going to bring about a healthy change within me for my health. The audience should actually accept. Only if there is the motivation is there, internalization of the fact, and the acceptance is there, then it is getting converted into a action. And another form of communication is persuasion. It is little above, it is a little bit different from motivation, because in persuasion the person is continuously inculcating the knowledge. He wants to change the person, he wants to change the bring on a new knowledge, and he is continuously persuading the patient to change his behavior. He is not giving the option like in motivation, but he is the person is giving a change, and he is insisting on this change. When it is done intentionally, it is called as brainwashing. This type of communication, it may bring about a short term change, but for a long term change, definitely motivation is the method. Then another method of communication is counseling. Counseling is a type of communication where the person who is giving the health communication should first of all be patient and actively listen to what the other person is telling. Counseling is very important in patients and conditions like HIV/AIDS patient. When a patient suffering from AIDS come to you, you cannot actually communicate to him straight away. These are the things to do. These are the things not to do. It will not. The patient is already in a state of depression. So what is needed is counseling. That's why the Centers for AIDS Care is called as ICTC, Integrated Counseling and Testing Center. So when you listen to him patiently, understand his point of view, and then you give the health information to him, it will be of more help for him. You should first of all motivate him that there are different options available with respect to HIV/AIDS. The patient can work, and no employer can deny him work on the basis of he is having HIV/AIDS. Like the CD4 count, irrespective of CD4 count, now the government is made free all the antiretroviral treatment, so you can get lifelong treatment. See, there is a person called Magic Johnson. This Magic Johnson suffered from HIV/AIDS, but because he took antiretroviral treatment, he lived for so many years. So, like this, when we give the motivation to him during this counseling session, it becomes a proper, appropriate health communication. and raising the moral is especially important when it comes to group peer, especially with respect to pulse polio program. Every year we are giving the health workers may think every year I am going to the field, I am giving the polio drops, but why unnecessarily I have to go every day? I have to check for the houses, I have to mark where is present or absent. So what is this? And the lowering of this moral can actually impact health communication is a very big way. So the group should be continuously motivated. See, the pulse polio program is conducted to entirely eliminate the disease from our country. So you should continuously motivate this group so that every year they go with that passion to eliminate. What are the changing concepts in health education? The basic concept in changing in giving the health education, health communication messages is, first of all, we are moving from prevention of diseases to promoting a very healthy lifestyle. Then we are involving the uh, people in planning and implementation of health communication. It is a very good method of health communication because it is taking care of the principle of primary health care. We all know the four principles of primary health care: equitable distribution, community participation, intersectional coordination, appropriate technology. So wherever when these new concepts are there, we have to write about this primary health care concept. So here again, the in health communication, this primary health care concept comes. So the community participation is important in planning of the health communication. Similarly, all the intersectoral coordination is there when there is health communication is given. It will be even more helpful. For example, the local panchayat leaders, the local school government teachers, then the public distribution system supplier, and the local panchayat president. So like the local politician. So all these people, when they are all involved together, when there is intersectoral coordination, the communication gets better. So these are all the changing concepts in health education. What are the approaches to health education? So there are four different approaches to health education. They are regulatory approach, service approach, health education approach, and primary healthcare approach. What is regulatory approach? It is giving legislation. For example, if you want to prevent smoking, we give a law that you should not smoke in the public places. We have a law for prohibition of alcohol. We have a child restraint act. These are all regulatory approaches to bring about a behavior change. We are using the law, we are using coercion, we are using compulsion. This form of approach may work out in some situations, but most often it becomes a failure. For example, compulsory helmet and heavy fine levied on this usage of helmet, usage of car belt, prohibition of alcohol. Even after implementing so much law, making the law very strict, even after that, the people are still not accepting this change. They are not willing to change their behavior. So they are saying 101 reasons for this, for not changing their behavior. Then, so the another form of approach to health education could be a service approach, giving the service at their doorstep. But again, there is a problem. The service approach should be based on felt needs. For example, the government implemented the water seal latrine to be given free of cost to each household, but it became a failure. Why? Because people didn't want to use a water seal latrine. They are still comfortable with open air defecation rather than going for a open seal latrine. So, service approach should be based on felt needs. Third thing is health education approach, which is a much better approach where we are giving a proper health education right from young age, right from school age. If you give proper health education messages regarding right from nutrition, infection control, till prevention of accidents, all these content, if it is given in the form of health education approach, the changes may be slow, but it is long term. Because when you start at school level itself, when you start giving these such type of education, what will happen is the students get these messages, they change their behavior. When they become adult and when their children are born, that the behavior is going to continue in that child also. So what I'm coming to say is, even though the change may come slowly, it will be persistent in health education approach. And the recent approach is primary healthcare approach, where we take into consideration all the four essential principles which I already told you. And when you take into community participation and intersectoral coordination in health education approach, it is going to be much better and successful. what are the models of health education? Medical model, motivation model, and social intervention model. In medical model, the patient is coming to the doctor, so doctor has the opportunity to give the education, but does give information about health condition. What is the problem he is suffering from? What is the tablet he has to take? How many days he has to take? He is taking care of all these things, but what is the problem is he is neglecting the physical, social, psychosocial environment from which the patient is coming. So that part component is lacking in the medical model. Then is the second is the motivation model. In this motivation model, all these things which I am talking are taken care of. All the psychosocial component, psychosocial component. What is his approach? What is his affective domain? What is his cultural? What are the cultural factors? When you take into all these factors and give a health education, it is going to be successful. And the third thing is social intervention model. It is again is a very useful model wherein we take into account a group of people. I already told about the stakeholders, the school teachers, government teachers, the public distribution sector, politicians, panchayat raj. When all these group of people are gathered together, and when they are convinced, when we convince them and when we ask them to change a particular type of behavior, definitely change will happen. So that is social intervention. The group is intervening. This group of people is intervening in the behavior change. So it is again is going to be a very successful model. Next is what are the principles of health education? This is an important essay question. First and foremost is credibility. The person who is giving the information, whether he is following it or not, the same information, whether the information he is giving is a true information. So based on the person giving the information, the credibility of the information, the health education messages will reach the community. Then the interest, whether the audience, the people are interested in receiving the message, it forms a very important principle. Third is participation from the people, whether the people were involved in planning and implementation of the health delivery of the health message, whether the people were involved, whether the people's participation was there. It also influences the success of health education. Next is motivation, we have discussed already, and comprehension. If you give the information to the patient, like a doctor gives the information that you have to take, you should avoid the starchy foods. The person may not have heard about starchy food. Starchy food. A village person will not know what is a starchy food. Similarly, if you tell a village mother regarding the medicine syrup, you have to give 1 teaspoon 3 times a day. The mother would not, the village woman would not have seen a teaspoon in her life, or she may not know what is a teaspoon. So the information you are giving should be comprehensible by the audience. And reinforcement, any information when you give for the first time, definitely the people will forget. There is a famous Chinese proverb: if I hear, I forget; if I see, I remember; if I do, I know. So anything which is given for the first time, it is highly likely that the people may forget. So what is needed is the information should be repeated. And what is the next thing in principle of health education is learning by doing. Anything which is given in the form of a workshop, the person actively does it. For example, a suturing technique, how to give an injection, how to give oral rehydration, prepare a oral rehydration solution from home. So all these things, when they are given by as a demonstration and the people are encouraged to first do it and see, then it becomes learning by doing, which is the best form of health education. Then in another most important principle of health education is from known to unknown. Any information you are giving, first of all, the information should flow in such a way that people first should know what they know. People should be taught about what they know. From there, you have to take them to the unknown. Then it becomes a better form of communication, which is a very important principle in health communication. And you have to set an example for each and everything what you are telling, which is a very good principle of health education. Like this, the good human relations forms a very important principle in health education. feedback, which forms a which is a backbone of health education. The feedback should be there always. Only from the feedback we know whether the information has properly reached the community or not, whether we have to refine the information, whether we have to reinforce the information. Everything is possible only when we get a appropriate feedback. It's a very important component of a principle of health education. And lastly, leaders. It is the leaders who deliver the information. It's the panchayat leaders, political leaders, doctors, nurses, village dais, anganwadi workers. They are all components of leaders. They are all agents of change. Next is the practice of health education. How to give the health education? What are the means by which we give the health education? We have audio visual aids, auditory aids, visual aids, and combined AV aids. And what are the methods in health education? Could be an individual approach. A one-to-one approach is always the best method of communication. Only problem is we cannot give a large scale information on one-to-one basis. It's costly and time consuming. In group approach, usually we use a chalk and talk method, which is a lecture. A lecture is should contain an audience of not more than 30. You use a chalk and board method to deliver the content to the audience. Only thing is it could be unidirectional. When it is a Socratic type of communication, there could be a much better learning that will happen. And demonstrations. Demonstration is a very good way of teaching new skills to the people. Group discussions. A group should contain 6 to 12 people. In a group discussion, always there will be a group leader who will be directing the communication. He will avoid the unnecessary distractions. He will see that the discussion goes in the planned way. And there will be a recorder who will record the proceedings. Each and everything which is being discussed will be recording. So there will be a group leader, there will be a recorder, and a group will consist of 6 to 12 people. Then panel discussion. Panel discussion usually involves about 4 to 8 people who are leaders in that particular field of discussion. They will sit in front of a large group of audience. So they will invite the audience participation. They will invite the audience to ask questions. They will answer the questions, and the discussion will happen. Usually the discussions will be in an unplanned manner. They will be discussed, but the thing is the topic of interest will be discussed. Here again a very good learning will happen. Symposium is another method of learning, wherein a series of lectures or talks are delivered by people, and at the end of the symposium, the organizer will summarize the event. Usually the discussion is minimal in symposium. Workshop is a very good method of learning, because here in this model, similar to group discussion model, there will be a group of 4 to 6 people, and there will be a group leader, and there will be active participation from all the group members. Only problem with group discussion is sometimes the people may be shy and they may not be actively participating. So it is the responsibility of the group leader to actually motivate and encourage everyone to participate in the discussion. And role playing, for example, the old methods of role playing, like the traditional methods of role playing, like Notanki, Burrakatha, all these Nadagam in Tamil, all those things can be used to deliver the information to village audience, illiterate audience. It is the best method of health communication, role playing. And lastly, the conference and seminars, which happen for a large group of audience. What are the audiovisual aids we use in mass approach? Television, radio, internet, newspaper, printed material, newspaper, direct mailing, posters, billboards, signs, health museums and exhibition, folk media. These are various methods of mass approaches. The only thing is, whenever we are using posters, pamphlets and all, the health message should be given in a precise manner. It should be short, and it should deliver what it is supposed to deliver. It should when we are telling about malaria, you should not include information about tuberculosis and confuse the people. So lastly, we will discuss about the administration and organization for health education in our country. In our country, the Central Health Education Bureau under the Ministry of Health is taking care of the health communication. Similarly, there are various agencies like Press Information Bureau, Doordarshan, All India Radio. All these agencies carry on with delivering the health education messages to the community, and there is a private agencies like Indian Red Cross which give the health education messages, and in WHO there is a separate wing for health education. And for India, there is a Southeast Asia Regional Bureau under the International Union for Health Education, and the headquarters is located in Bangalore. So that's all about the health communication chapter. Please go through Park for detailed information regarding the chapter. Thank you.